Disability Inclusion Action Plan submission from the Disability Action Hall. We got together and talked about work, income, access, and eligibility for services. Here are the stories from members of the hall, beginning with eligibility for services.
That they're easier to get if you need it.
Eligibility and also accessibility to mental health services. I think the way that we handle mental health in this country and on a global scale, but for this video specifically, this country, is horrific. And the fact that we let a lot of people fall through the cracks because we refuse to look into the hospital and the people providing services to ensure that they are providing the services correctly. And also the fact that we're just assuming that people with mental health problems are comfortable or feel safe to report any kind of abuse when a lot of people don't feel that way. That's just wrong. And we need a better system. And I personally think, you know, you would think that universal health care would include mental health, but from my experience, it doesn't.
$400.
Wow.
Did you say $400?
Wow. Expensive.
And is that covered by ACE or not covered by ACE?
No.
Having income that is indexed to the cost of living, with an understanding that people that have disabilities have a higher cost of living themselves because of medication. Also, that accessibility goes beyond physical space and it actually includes income. So for example, if you want to have education accessible, so education, post-secondary education to be accessible, you need to have income that makes that accessible. So just seeing accessibility beyond the physical space is important.
The government of Canada could help around income if they didn't have, you know, income coming from one level of government and being taken back from another, which is really confusing for people. So that if they could coordinate that a bit more so that people weren't, like, for example, getting the CERB and then having it clawed back by ACE.
Government needs to do, and all the provinces need to come together on it, is to have a national disability strategy and a national ACE program or whatever you would call it, so that everybody in Canada gets the same amount and that they get all the benefits that they're entitled to, because a lot of these people on disabilities are very impoverished, and if they were to provide all the medications and benefits to these people, they'd be a lot better off.
Tying the amounts that are given for income to inflation is really important, not just for the money, but for the sense of security that gives people to know that if costs go up, so will their income.
Variation between provinces about how much they think people deserve, and it shouldn't be about that. It should be about the rate of inflation. The rate of inflation goes up, then that person's income should also go up. It's common sense. And we need to have a universal basic income. That's what it comes down to.
To get around, and that struggling for to get around and all that. Just make it easy for them and make the transportation more affordable for them.
But places like High River and Okotoks, yes, there's on it, but it has the wrong time of day scheduling. Like they're early in the morning or really late at night. And if you only want to go for like a small grocery shop and you need stuff that you can't get in your own community, then they should be able to go back right away and not have to wait a whole day to go back and have their food get spoiled or whatever they need to go off the wayside. So like not only for big cities, we need that for rural towns like mine, like High River and Okotoks, and affordable too.
You should have a national bus service across Canada. It's a shame they don't have it, you know. People that with disability, they gotta have a way to go around, you know, different places. I think they should have a national bus service. Yeah. A cheap bus service, not too expensive, but
Free internet would be great all across Canada. And I agree, a national public transportation would be fabulous. It's not enough to give the capital to buy the bus, but to actually operate the bus, because that's what's happening. There's a grant out there right now for $50,000 for rural communities, and that's only enough to buy a bus or half a bus. And it sounds like a great announcement. It's nothing. Maybe you can buy some tires for 5 years.
I would like to see the federal government put, you know, stuff in plain language so people could understand, like the forms and everything. And then I like to see them put some kind of site on internet so you could go and look for information for disability. Yeah. Or some office you could go and find out, not go all over the place, look for information for disability. Yeah. That's what I would like to see. Yeah.